As a new nurse or a nurse in a new leadership position, delegation may appear intimidating. Delegation is an amazing tool and skill when done appropriately that can reduce stress, enhance time management, and increase teamwork. To begin the utilization of delegation, one must first understand what it is and when to use it. In accordance with our text, delegation is the assignment of authority to complete or perform a task. Delegations allow for transference of responsibility, but not transference of accountability. Therefore, it is important for the nurse or delegator to evaluate the task for completion and procedural compliance. Another part of delegation is knowing what can be delegated and who it can be delegated to. Delegation is typically linear and downward. This means you can delegate to other nurses that share your scope and also to support staff. You typically would not delegate to superiors. When you plan to delegate tasks, you must have a clear understanding of the scope of practice of whom you are delegating. You cannot delegate a task that is beyond your scope of practice. For example, a RN should not delegate medication administration to an unlicensed support staff. This will be outside the scope of practice for a CNA. It is also important to take into consideration the knowledge of support staff and their clinical presentation of the patient. You always want to check your patient to ensure that they're a good candidate to have their tasks delegated. To help clear up when delegation would be most efficient and appropriate, South Dakota Board of Nursing created a delegation decision-making algorithm. The algorithm begins with questioning your own scope of practice in relation to the task being delegated out. If the task is outside of your scope, you shouldn't even be considering the delegation. As the algorithm goes on, it outlines if delegation would be aligned with the Nurse Practice Act, if it is a commonly delegated task, is it in line with the organizational policy. It provides a reminder to evaluate the patient and completion of the task and to ensure that it was done appropriately and properly. Also, you want to understand the knowledge and competency of the person you're delegating to. You want to make sure that the person you're delegating to have a clear understanding of the task and what is required. This is an algorithm that can be implemented at all facilities to guide the decision of appropriate delegation.